Hello, everyone. Welcome to Wellness Wednesday. Lindsey, the pharmacist here, Wellness from D Consulting. And this Wellness Wednesday, we are going to be talking with Dr. Allison Phillips. She is a physical therapist, and I'm lucky enough to share my DNA with her. If you can't tell, we are related. This is my sister. And she and I got onto this topic for Wellness Wednesday when we were talking about COVID and how it's changed our patient populations and our lives. And I said, hey, we probably should do something about this because you see COVID on a daily basis. You see all different types of patients. So why don't I'll just give you the floor to walk us through those categories and maybe even at the end some prevention or how to be well after COVID.
Yeah, perfect. Hi. As Lindsey said, I'm a physical therapist, and my main area of population that I treat is within the neurologic population. So that includes a bunch of different diagnoses like stroke or Parkinson's disease, multiple sclerosis, et cetera, et cetera. But within my clinic, we see all sorts of different patients. People who have orthopedic problems like back pain or shoulder pain, even people who maybe had a surgery, things like that. You will go see a physical therapist for a lot of different things. And when COVID happened, it was not only the patients that were coming to see us that actually caught COVID that were having problems, but the year of not being able to leave your house was showing so many other kind of lesser, but still very real detrimental side effects. So for example, you could have a super serious bout of COVID where you end up in ICU and come up with something called critical illness myopathy. They don't really know what it is and how it happens, but a lot of patients who are ventilated and on a ton of medicine, sedated, in the ICU tend to get this critical illness myopathy, which is where your muscles just start to weaken. You don't use them, you lose them. Everyone's heard that, or most people have heard that. And that's just sort of taken to the 10th degree when you're laying there doing nothing. You can also have something called critical illness polyneuropathy, which is where the nerves stop working. So now you've got your muscles that aren't working, and you've got your nerves that aren't working, which leads to a form of temporary paralysis. So as you recover from your illness, you usually get back most of your muscles and your strength, but not all. That's super rare. Those are the ones. Yeah, go ahead, Lindsey, in the front.
I'm raising my hand over here. What about your nerves? Do those usually typically recover from?
Yeah.
Okay.
Yeah, so they'll regenerate, but it's if you think about a nerve that goes like from my neck down to my fingertip, that's a pretty long nerve.
Yeah.
And if that nerve starts to die is a harsh word, starts to not work anymore because signals haven't been getting to it, then from my fingertip and up starts to just lose function. So you lose function from your outside in.
Okay.
As it regenerates, it grows like about 1 millimeter a day. So you've got to think about this recovery coming all the way back down into your fingers, taking however many millimeters that is.
But physical therapists can accelerate.
Yeah. Okay. Yeah. So the treatment for it, beyond just stop being in the ICU, when your body starts to recover, the treatment is then to use those muscles. When of course they don't want to be used. They're weak, they're painful, it's weird tingly sensations. So you go to a physical therapist and they can help you use those muscles in safe ways to help regenerate those nerves faster. Yeah. Yeah. So that's a small portion of it.
We have a rare category of severe, very severe.
Yeah. So let's say you just got a moderate case of COVID where maybe you were even in the hospital, but you didn't have to go into the ICU. You weren't ventilated. Perhaps you were just super sick at home. Didn't even have to go to the hospital. You can have what's being categorized as permanent damage within your lungs, but not necessarily that nerve dying, muscle dying. That
scar tissue, right? I've built up scar tissue. It's hard in my alveoli.
Exactly. Yeah, exactly. So they're finding this permanent scarring in all ages of people. Maybe you have to be on oxygen, supplemental oxygen for a while, where you've got your little nose cannula and you have to carry your little oxygen around. I've seen plenty of patients in their 30s who've done that for a temporary amount of time after recovering from COVID. But what we don't know, and what studies out of China are saying, even how a year and a half out from this pandemic, is that that permanent scarring is indeed permanent. You're going to have scarring in your lungs of some sort if you get it in the beginning. They're not seeing it going away. Maybe 10 years from now it will go away, but right now it seems to be stuck there, and your function will then be limited based on how much scarring you have. You'll be okay. I mean, you're not going to be paralyzed, right? Like, you'll be okay, but you're going to be short of breath and things. So physical therapy can help with that also, not only strengthening your muscles, getting you kind of your heart rate up again, using your lungs again, but also in a safe way, so you don't hurt yourself.
I also like to point out physical therapy can do a baseline for you, right? Whether you've had COVID or not, if you just want to get out and be more active, or you've had, maybe it's not even a COVID illness, it could be another illness or disease state that's taken over and has caused you to regress, you'll get a baseline of physical therapy. And that's nice because then you can track progress.
Yeah, absolutely.
What are some of those? Like, what's an example?
Yeah, so it's much, physical therapy it is a doctorate degree. We do learn a lot of things. It's not just going and exercising. We know stuff. Yeah. So what we'll do for all of our patients is manual muscle testing of all your muscles to make sure they're all firing correctly, particularly in my population, because you can have weaknesses in different areas, but every physical therapist should do this. And then we have what we call age normals or age normal tests, where we'll say, test your leg strength, we'll test your balance, we'll test your endurance, and then we'll get a number of some sort that will get spat out to us. And we'll be able to compare that to your age normal. Okay. So a 34-year-old female should be scoring this on this battery of tests. And if I'm scoring below, then of course we want that to come up. And if I'm scoring at or above, then everything's fine and we don't need to treat you. We're not going to treat you unless you have an impairment.
Okay, right. Makes sense.
Hopefully.
And so for your, as we're not post-COVID, right? But as patients have started to trickle in and back into physical therapy, your main population is this inactivity population, or being housebound and not doing the normal, even socializing, which might have included hiking and walking, and even that, what did you tell me the other night? Trip around the mall? Like, yeah, the trip around the mall mattered.
Yeah. So to go back to our categories, sort of, if we're looking at severe, moderate, then there's the essentially least severe, where you catch COVID, you have no lung scarring, you don't have any of this myopathy or polyneuropathy, but you got it, you got sick, and now you're trying to recover from it. Included in that category is what I'm going to say, what you're talking about, those folks who didn't ever catch COVID, but couldn't leave their house because of restrictions that were in place and safety measures that they needed to follow. So even the really inactive people who weren't hiking and weren't running around going to gyms or trying to go to outdoor gyms, even the people who just thought, well, I'm pretty homebound anyways, did even less. Wow. So you're not going to the grocery store. You're not going to see your kids. You're not having your kids over. So like, your brain isn't having to function. Even if you're just sitting there, you're at least maybe interacting with someone. You lose all that both cognitive and physical function for a whole year. Yeah.
Stimulation. And we've had all this languishing as a society. You and I have chatted about that too. It's a languish physically, mentally, emotionally. Mm-hmm. Yeah. So this category is also showing up to physical therapy.
Yeah. So for me personally, I have a lot of my patients that I'll do an annual reevaluation on anyways. So if you have a chronic disease like Parkinson's, you need to be going to physical therapy in some capacity for the rest of your life. And so if I don't see you for a long time, like multiple years, you're probably going to decline. So I try to set up with my patients every single year. We at least come in, we do those battery of tests that I'm talking about, compare them to where they were last year, and either then decide to do physical therapy or not, depending on how you score. Well, patient after patient after patient kept coming in, and they're scoring significantly lower than they were a year ago. And I'm saying to them, well, did you get COVID? And they said, no, we just couldn't go anywhere or do anything. So we didn't.
Right.
And I'm like, but wait a minute, you're so much worse. And we know that your diagnosis doesn't progress that quickly. Parkinson's doesn't get this much worse in a year. It gets this much worse in a year. So the inactivity made the symptoms worse, which made their balance worse, their strength worse, their endurance worse. Everything just went downhill. And that means that, we have to see you. We just have to get you back in and exercising and working in a safe way.
In a safe way. And you have to commit to home, like, I'm gonna get out, I'm gonna get up, I'm gonna, even if the house doesn't need dusted again, maybe I'm gonna dust it an extra time, like something to activate those inactive muscles and nerves.
Yeah, get moving again. And I've the stream of patients coming in that are worse due to inactivity is slowing as everything starts to open up, which is good.
Yeah.
But the people who are in that high risk category, older, comorbidities, lung problems, they're still hesitant to go out in the world, as is fine. That's appropriate. Even with the vaccine, a lot of my patients are still hesitant to go out. So trying to get them up and moving is all that you can do and all you can ask for. And then even the young patients who maybe I don't see as much, but my colleagues are seeing, I play more video games and I'm watching more TV, and I really just have more knee pain now when I try to play soccer again or whatever sport they choose. So you just have to start getting up and getting going.
That actually brings us to a great point about how you can't just go back into everything you were doing previously healthily. You will risk an injury that will again land you in a doctor's office and ultimately a physical therapist's office again. You can't go out and run 10 miles if you haven't run a mile for a year and a half. So another thing that's great about physical therapists is that they're not going to put you on the treadmill to run those 10 miles. They're going to give you those incremental steps. And I mean, you have had, the 2 AC joints, you've had 2 ACLs, I've done the 2 shoulders and the back. Like, we've, as a family, probably had enough surgeries to cover a few families. We know that when we start our rehab for those things, just like when you start a new exercise routine, you start at the base and the bottom, and then you build on those and you make them incrementally more difficult. And I would like to say that's another benefit of, and if you're like, I don't need physical therapy, I just need a guide, that would be where you would come see me, right? I could help guide and increase your exercise regimen. But I would still argue that if you have any ailment, you should start with a physical therapist.
Yeah. And I mean, ultimately, the world needs more people like you who have a business that focuses on wellness and function, so that together, like, maybe a person comes and sees me and I say, you don't need me. You don't need to pay for me or whatever I take. Go to Lindsey, go to this wellness doctor. And there are some functional medicine doctors that are starting out, but it's so much fewer than is necessary. So I think having a collaboration is key, and it's big, because knowing what to do and when to do it is not on you. It's on the people who have been educated and prepared themselves and trained for things that perhaps you never even thought about. Wow. And I think a nice example is I could get our sports medicine physical therapist in here and he could talk for days about the injuries he's seen post COVID because kids with
Stability.
the kids.
Instability.
Yeah, they went, well, I was laying on the couch for a year. I can probably go play basketball.
ACL.
Probably not, right? Like, so that's a whole nother topic on like sport recovery and return to sport, which
We can do
functional testing for that and numbers too. And then there's my population, which I think is the vast majority of the people that we see in physical therapy who are older.
Mhm.
And maybe you already have a lung problem or you have a heart problem and you're on a bunch of different medications, and we really need to keep an eyeball on your vital signs. So I'm going to monitor your heart rate, your oxygen, and your blood pressure, and educate you on how to know when something is safe, whether you feel it or not. Because I think feeling something and feeling either overexerted or underexerted is such a subjective thing that if you haven't experienced it, you don't know what to do. You don't know.
Am I safe? Am I not safe? So then you can say, get a Fitbit or a Garmin or an Apple or whatever. These are your safe ranges.
Yeah. I think putting numbers in front of people is just a super easy way to say, you know what, doesn't matter if you feel like you're not working hard enough. If your heart rate is this, you are working hard enough. And vice versa. If you feel like you're working too hard, but your heart rate is this, you might actually not be working too hard. This might be an okay feeling of exertion for you. And we have charts and we have scales and all sorts of ways to quantify feelings of exertion, so you don't have to be nervous about exercise and pushing your body
Inappropriately. Safety, right? Like you can know you're safely. And also I find that when you come back into things like being comfortable with getting uncomfortable.
Mm-hmm.
It's not like I remember those first couple shoulder surgeries and getting the arm up the window. It's not comfortable, but I could get used to the uncomfortable. And then after so many weeks, the range of motion is there. So it's get uncomfortable too.
And to have that be a totally new feeling for you. The biggest symptom we see after COVID is the pain and pressure in your lungs. And so a lot of people have had shoulder pain. A lot of people have had back pain. Whether they know how to treat it or not is neither here nor there. But chest pain and tightness and discomfort and pain, that's scary.
Yeah.
That's like what's happening to me. So to be able to say, okay, well, your lungs have muscles and your heart is a muscle. So all of those things weaken, just like your biceps and your triceps weaken. So when you try to build back up your lung function and your heart strength, it's going to be uncomfortable. But we don't want you to feel like your heart's going to explode.
Right.
Because then you get anxiety and it's like, oh God, now I'm really not going to exercise because I'm hurting myself. And I don't know how many times a day I say, just because something is uncomfortable or even hurts doesn't mean you're damaging yourself. It doesn't mean you're hurting yourself. But how would you know that unless someone told you? Yeah.
Yeah. I love it. I love physical therapy. I could live. I do. I go for tune-ups. I'm a tune-up kid. What would you say to patients who are like, okay, I'm going to start getting back into things. I'm pretty comfortable with knowing my body. What about prevention or anything, any tips or guidance there? Yeah. She's doing it too.
Yeah. I think the biggest thing is it's never too late. Research study upon research study upon research study has shown that just because you're old, or just because you've had 1,000 surgeries, or just because you've had COVID, or just because you've been in the hospital 6 times, it does not matter how broken you may be or perceive yourself to be, you can still make improvements. Yeah. I had a patient the other day. She has it's a really not fun diagnosis. It's a progressive muscular dystrophy where your muscles just shrink and there's nothing you can do about it. And she's in her 70s. And she's at the point in her physical therapy now, I've seen her for a couple of years, that we're just trying to maintain.
Okay.
You're not going to get any better. Let's try to keep you from getting worse and hope that science maybe finds a treatment for you before you die. And she's like, okay, I'm ready for this. And I said something to her the other day about how I had exercised that morning, or how I was exercising multiple times a week. And she said, why are you exercising? You're skinny. And I was like, well, I exercise to constantly make improvements in my body that may look completely normal to you, but still could be improved to me. Whether I have pain or some weakness somewhere, or I just in general like the feeling of exercise, no matter where you are in your lifespan or your fitness journey or your lack of fitness journey or your MS or your Parkinson's, you can still get better with exercise.
Right. And
So it's
mental
never
health
too late.
too. It's never too
Oh
late.
yeah.
The mental benefits and exercise, the stress benefits.
Mhm. So it's never too late.
Yeah.
I can't emphasize that enough. And then once you start exercising and you start improving yourself, and it's not just strength, you guys, we can help you with balance, we can reduce your falls, we can increase your circulation, so maybe your blood pressure goes down. There's a lot of things that we can help you with. And then once you have that and you start that routine, if you do happen to get sick or something, you go in the hospital, or you do have a fall, you're not going to go downhill as much because your baseline is now higher.
Right.
So that's how you prevent this continued decline. You build up your baseline so that when something knocks you down a bit, it doesn't knock you down here, it knocks you down here.
Great advice.
Yeah.
So baseline, it's never too late. Anything you want to add? Or a random fun fact? We take it all here.
I know. I do. I told you this quote the other night. I had a doctor was giving a presentation somewhere and he said, if exercise was a pill, every doctor would prescribe it and every patient would take it. Any sort of activity, whether it be a formal exercise program that you go out and get yourself, or that a physical therapist gives you, or an activity you enjoy like hiking or walking or biking, try to take that exercise pill every single day or every single week, or at whatever capacity you are physically capable of doing it. Because there are super few diagnoses and problems that exercise won't help.
Right. And like all medicines, start with a low dose and work your way up, right?
Mm-hmm.
Don't overdose.
Yeah.
That's such a thing as too much.
Absolutely. And I've got a lot of my patients who come in and they're really skeptical of physical therapy, and they say, well, I'm 85 years old. I don't really want to work hard. I'm kind of having a good end of my life here. I'm here because my doctor told me to be here. And know that if you come in and you tell me that, I'm not going to put earplugs in and not hear you. I'm going to listen to what you're saying. I'll work with you to figure out if physical therapy is something you even need. And maybe we just have a conversation about how to maintain where you are.
Yeah.
And maybe that means you don't come back. And maybe you need a different walker. Maybe you need a walker. Maybe you want different shoes and you want advice on best shoes, or whatever it is. If you're in a physical therapist office and they're making you exercise when you don't want to, just like any other healthcare provider, go to a different one. They're not listening to you. They're not listening to what you say and what you need. And I'm really honest with my patients. I'm like, look, yeah, you are 85 with MS. This is rough. If you're just done and you're okay with it, I'm okay with it.
Yeah.
That's okay.
Yeah. Be honest, be open, communication.
Yeah.
Awesome. Well, sister, I think this has been Dr. Phillips. She's my sister. I call her sister all the time. I think this has been great. I hope our patients get a lot out of it. I hope we can share it around. I know I have a couple long hauler COVIDs, and I'm encouraging the activity and increasing slowly, and lots of working on lots of inflammation processes with gut health and antioxidants. But yeah, I think the physical therapy side of life for any of us is crucial. And I think that you are a testament to that every day. So all of us are thankful for you.
Aw,
And
yay.
I appreciate this bouncing ideas. We'll probably have to bring you back for more because of the.
I'm up for it. I'm game.
All right.
Yeah.
Well, and anything else you want to add? You're all
I don't think so.
okay. Well, thanks for being on Wellness Wednesday.
Sure.
Get it posted, and we'll do another one.
Okay. Sounds good.
Bye.
Bye.